Good afternoon, everyone. I'm Dr. Ashmita Pandey, all the way from Nepal. I would like to welcome you all to this program. I have been delighted to be a moderator to such a huge gathering of gynecologists and fertility specialists, and I'm honored. I have been in this field for last 3 years, and hopefully this discussion is going to go great. So I would like to introduce Sir. I know Sir doesn't need any introduction, but still I would like to welcome Professor Dr. Pankaj Talwar Sir, who is also CEO of iHoma Fertility Clinics and IC Training Academy. He is a Dean of Department of Clinical Embryology, Sridhar University, Delhi. And he has been awarded with Vishish Seva Medal by the President of India for working in the field of fertility for last 30 years. So more is less when it comes to your introduction, I guess. So today's topic is on AMH, basically on low AMH. So what is AMH? AMH corresponds to individuals' egg counts. So what is the normal range of AMH? It's 1.5 to 4, but it varies according to the age. And then talking about the low AMH means low egg count, but it does not mean that your fertility is low. So without a further delay, I would like Sir to take away the stage, and I would like Sir to continue with the topic. Pankaj Sir.
Thank you very much, Asmita. Thank you so much, everyone who are present here. As promised to all of you that we'll be back soon. We are back to you within 15 days of the last Facebook Live. आप सबसे बात करके हमें अच्छा लगता है, and we got so many phone calls from you, so we feel really delighted to take your queries. आज का जो हमारा today's topic which we have kept for all of you is called AMH, and commonly the women come to us nowadays and tell us that their AMH is low, and it's become so much of a common condition that we thought we must speak to you today about AMH. तो आज हमारे साथ हैं डॉक्टर अस्मिता पांडे. शी इज फ्रॉम वात्सल्य IVF from Kathmandu. It's one of the most busiest clinics in Nepal. I'm sure that I think they are the most busiest unit in the Kathmandu too. So Ashmita, we can start now. And I think we'll take some common queries from your end and queries from everyone in the audience. We can take them as we go on. Thank you so much.
Sure, sir. So can we start with saying what does AMH means first?
So for all the people who have joined today, I again bring greetings from our institute at New Delhi and from Asmita. So anti-malarial hormone has become a very common subject of debate when we talk about IVF or IUI or any fertility practice. तो मैं आपको बताना चाहूंगा कि जब ये टर्म आई 2010 या 11 के अंदर, तो बहुत कम लोग इस जांच को किया करते थे. इसे ब्लड टेस्ट, AMH is a blood test, Asmita. Not many people did work on AMH, and we always thought ये AMH क्या चीज है और ये जैसे आएगी और जाएगी. परंतु as the time has flown, AMH is holding a very important role in terms of diagnosing a woman's fertility potential. AMH is called anti-Mullerian hormone. और AMH एक स्त्री में ही नहीं होता है. It is also found in young boys and girls both. जो छोटे babies होते हैं when we take birth, they both have AMH, and AMH is more in the male babies than the female babies. As the levels of AMH are more in the male, they turn out to be a male sex, and on the other hand, in case the levels of AMH are less, they turn out to be a female baby. And as the women grow, the levels of AMH in her body are quite low. जैसे मैंने बोला कि छोटे मेल बेबीज में ये वैल्यूज ज्यादा रहते हैं और फीमेल में कम रहते हैं. और जैसे ही वो छोटी बच्ची बड़ी होती है तो उसके बदन में AMH के वैल्यूज बढ़ने शुरू हो जाते हैं. They touch the peak somewhere around her teenage. That's the time when AMH is going up. उसके बाद AMH धीरे धीरे ढलान पर आना शुरू होता है after around 25 years of age, and by 40-45 ढलान बहुत acute होती है और AMH कम होता रहता है. अगर आप सिंपल एग्जांपल मैं आपको देना चाहूंगा, I've kept my card with me. It's a credit card or a debit card. ये कार्ड दर्शाएगा कि हमारे बैंक में हमारे पास कितना पैसा है. इसी तरह से जो AMH की वैल्यूज हैं, दैट इज कॉल्ड एंटी मुलेरियन हार्मोन, अगर हम किसी भी स्त्री का ब्लड टेस्ट करेंगे तो वो बताएगा कि उसके जो अंडकोश हैं, हाउ मेनी एग्स शी हैज इन हर बॉडी. And in case we go back to the background, which I like to speak to all of you, when a young girl is in the utero, मतलब कि जब वो अपनी मम्मी के कोख में होती है, छोटी बच्ची, when she is a small fetus, उस समय उनके अंडकोश के अंदर तकरीबन 6 से 7 मिलियन एग होते हैं. मिलियन का नंबर हमेशा सब लोग कंफ्यूज करते हैं, मिलियन क्या होता है. सो जब हम 1 लाख को मल्टीप्लाई करते हैं विद 10, इट बिकम्स ए मिलियन. जब वो छोटी बच्ची परिपक्व होती है, when she becomes an mature child, when she takes birth, at term when she takes birth, that time in her ovaries we have around 2 million eggs. तुम देखेंगे कि 6 से 7 मिलियन से ये नंबर 2 मिलियन पर आ जाता है तकरीबन 20 हफ्ते के अंदर. And as the girl matures, when she touches an age of say 14-15 years, 14 or 15 years, that time she will have around 2.5 lakh eggs. तो कहा था 6 मिलियन, 2 मिलियन और 2.5 लाख. And as the girl keeps maturing, she attains the age of say 30-35, her eggs will come down to around 35,000 or 30,000. And by the time of 40 years, her egg reserve will fall down to nearly 8,000. By 50, they'll come to around 1,000. That's the way her egg reserve will fall down. अब ये जो भी उसके बदन में होता है, जो छोटे बच्चे के बदन में होता है, ये as it happens in our body as male also, we cannot count the number of eggs. हम उनको काउंट नहीं कर सकते हैं. इनको जानने के लिए we have to do a test called AMH. और AMH हमें दर्शाता है कि किसी भी फीमेल के अंदर कितने एग्स हैं तकरीबन. इन केस शी इज हैविंग लो AMH, तो उसकी बॉडी में कम एग रहेंगे. और मजे की बात मैं आपको ये बताना चाहूंगा कि अगर हम देखें कि कितने बार एक वुमेन ओवुलेट करती है पूरे जीवन के अंदर, तो ये नंबर होगा तकरीबन 400-500 का. सो हम शुरुआत करते हैं 2 मिलियन एग से. शी विल ओनली ओवुलेट, शी विल हैव अराउंड 4 to 500 menstrual cycles, and all the eggs will disappear. They will become weak and they will disintegrate. So एक AMH ऐसा टेस्ट है जो हमको बताता है कि किसी भी लेडी के अंदर कितने एग्स हैं, एग रिजर्व कितना है. और इसके यूनिट्स होते हैं AMH के, बड़े कंफ्यूजिंग होते हैं स्मिता. Some countries they follow nanograms per ml and some people follow picomoles per liter. So we have to know, जब हम एक वैल्यू को पढ़ते हैं तो हमें देखना चाहिए कि उसका यूनिट क्या है, नैनोग्राम के अंदर है कि वो पिकोमोल के अंदर. दिस इज वेरी वेरी इंपॉर्टेंट फॉर अस. अभी AMH आता कहां से, तो AMH हमारी बॉडी में कहां से आता है. तो हमको ये जानना है कि जो भी ओवरीज होती हैं, जिसे हम अंडकोश कहते हैं, उसमें अंडे होते हैं. To say in a very simple term, they're called eggs, or call them, मैं कह रहा हूँ उनके जो अंडे होते हैं, जो फॉलिकल्स होते हैं, जब वो बहुत छोटे साइज के होते हैं, जब वो 2 से 9 मिलीमीटर के होते हैं, सेकेंड डे थर्ड डे पे उनका साइज रहता है 2 से 10 मिलीमीटर. दैट्स द टाइम दे सिक्रीट AMH. एंड जब उस AMH को हम एक ब्लड टेस्ट के थ्रू जांच करते हैं, हमें दर्शाता है कि उस बॉडी में कितने एग होंगे, एंड वी कैन हैव सम इंटरप्रिटेशन इन आवर माइंड एंड देन वी कैन ट्रीट द वुमन अकॉर्डिंगली. सो किसी भी एक फीमेल के अंदर AMH का जो सूत्र होता है वो होता है उनके अंडकोश और ओवरीज. और समय आने के साथ साथ किसी भी लेडी के अंदर AMH के वैल्यूज कम होते जाते हैं. दैट्स माय सिंपल आंसर टू योर.
So I think you have already answered the second question as well. So my second question was, what happens when AMH is low?
या सो आजकल AMH कम होने पर क्या होता है. देखो, 2 चीजें हमें समझनी है. AMH दर्शाता है कि हमारे बैंक में कितना मनी है, लाइक एन ATM कार्ड. अभी किसी की अगर ओवरीज के अंदर एग रिजर्व कम होता जाता है तो AMH के वैल्यूज कम होते जाते हैं. अब नॉर्मल AMH कितना होना चाहिए, अगर हम देखें तो हम बोलेंगे, अब काफी लोग हमसे पूछेंगे कि नॉर्मल AMH कितना होता है. नॉर्मल AMH के जो वैल्यूज हैं हमारे बदन में इन ए फीमेल, दैट विल बी अराउंड 3. सो एनीवन हु इज अराउंड 30 years of age should have an AMH between 2.5 and 3. And जैसे जैसे her age increases by around 38, the AMH may become around 1.2 or 1.5, and by 40, it is around 1 or less than 1. So normal values of AMH are somewhere around 2.5 to 3. And as the values of AMH will fall down with the age, so कट ऑफ हम मान के चलते हैं 1.2 नैनोग्राम पर एमएल का. अगर AMH 1.2 नैनोग्राम पर एमएल से कम होता है तो हम कहते हैं उसके अंदर AMH के वैल्यूज कम है. और अगर AMH के वैल्यूज कम है तो उनका बॉडी में एग रिजर्व कम होगा और उनका एक मां बनने का जो प्रतिक्रिया है वो इफेक्ट होती है. अब जानना ये जरूरी है इसमें. वेरी वेरी कॉमनली पीपल फील कि अगर मेरा AMH कम है तो मैं मां नहीं बन सकती. सो AMH कभी भी नहीं दर्शाता है कि उसका फर्टिलिटी पे क्या इफेक्ट है. वो एक छोटा सा हमें एक इंडिकेशन देता है, बट दैट डजंट टेल अस दैट whether that lady can become the mother or not. Now everyone has to understand that the levels of AMH are normal around 2.5 to 3. But sometimes in a young girl, say 33, 34, 35, even she can have a low AMH. So जब किसी भी स्त्री के अंदर AMH के वैल्यूज कम होते हैं और उसकी एज 36, 37 से कम है, सो वो AMH उसकी फर्टिलिटी को ज्यादा अफेक्ट नहीं करता है. But when her age increases more than 38, then low AMH means that low egg reserve. Below 35, 36, low AMH means less egg reserve. बट इसमें कैच पॉइंट ये है कि अगर एक छोटी उम्र के अंदर AMH कम होता है किसी भी कारण से, एग क्वालिटी में इफेक्ट नहीं आता है. एग क्वालिटी इज गुड, वी से गोल्डन एग, सोने के एग है वो. सो बाय अराउंड 35, 36 AMH कम है, हमें चिंता करने का विषय तो है, पर ज्यादा वरी नहीं करना चाहिए, किसी को वरी नहीं करना चाहिए, बिकॉज क्वालिटी ऑफ एग्स विल बी बेटर. But after 38, low AMH means low egg reserve and also poor quality eggs. That's my interpretation about having low or high AMH. So cutoff is taken as 1.2 nanograms per ml in our country.
So that's very true, sir. So how does AMH lowers? I think you have answered that question too. How does AMH lowers with age?
Yeah, so एक चीज पूछूंगा मैं आपसे अस्मिता, in your country in Nepal,
Yes.
आपको क्या लगता है? What do you feel about the values of AMH? क्या हम लोग बहुत ही करीबी हैं? अगर हम देखें एक इंडियन सब कॉन्टिनेंट के अंदर नेपाल भी आता है, तो नेपाल के अंदर क्या वैल्यूज मिलते हैं आपको AMH के, जो हमारी कंट्री में वैल्यूज कम दिख रहे हैं AMH के? डू यू आल्सो फाइंड द सेम थिंग इन नेपाल आल्सो, और
Yes,
वहाँ
yes,
कुछ अलग
same.
से
And most
वातावरण?
of the people are ending up visiting us after the age of 35. So I think it's
35.
because of delayed planning of child. I mean pregnancy as well. So AMH are really low these days.
सो इन यंग पॉपुलेशन अगर आपके पास में आती है नेपाल के अंदर, हम इन इंडिया वी फील दैट इवन यंग गर्ल्स हैव गॉट लो AMH. But in Nepal, do you find that incidence of AMH
Yes,
is
sir.
going down overall?
Yes, sir.
Okay.
And when we check them for other autoantibodies and other kind of disease like anti-TPO, APLA profile, ANAS and all, so they are coming positive for those kind of antibodies as well. So I think there are
Okay.
association with those things. So lots of people with ENA positive, APLA positive, they are coming with low AMH.
लो AMH. वेरी गुड.
Yes.
सो अब जो आपने सवाल पूछा, आई थिंक इसका जवाब हम चाहे किसी भी मुल्क के अंदर है, वी आर पार्ट ऑफ एनी पार्ट ऑफ एनी कंट्री इन द वर्ल्ड, आई थिंक द आंसर विल बी दैट व्हाई इज AMH लेवल्स फॉलिंग डाउन. AMH की वैल्यूज क्यों कम हो रहे हैं? सो व्हेन वी गेट अ गर्ल who's crossing 38 years of age and she's getting married late. Normally women nowadays are getting married late because uh, they are trying to achieve something in their life, so they get married late after 38, 39. तो वहां पे अगर we get low values of AMH, that is taken as quite normal. बट जो बाकी क्या कारण है कि यंग पॉपुलेशन के अंदर वैल्यूज ऑफ AMH आर फॉलिंग डाउन, दैट्स व्हाट आई वांटेड टू आस्क यू स्मिता, एंड यू आंसर्ड मी वेरी करेक्टली. आई थिंक जो मैं महसूस करता हूँ शायद वही आप भी महसूस करती हैं अपने देश के अंदर. सो आई थिंक जो कॉमन कारण है AMH के वैल्यूज कम होने के can be, first of all, getting married late. That is one, or coming for fertility treatment at elderly age. Number two, I think having having higher BMI, body mass index. That is one condition where having some infections which can affect the ovary, like tuberculosis. There can be endometriosis which can affect the quality of the eggs. Then there can be genetic diseases. फिर जो हमारी हैबिट्स हैं, जो नॉर्मल हमारी हैबिट्स हैं, नींद कम करना और ठीक समय पे खाना नहीं खाना, environment, and I'm very clear that things like which we call as endocrinal disruptors, having water in the plastic bottle. So there's a lot of things happening in the atmosphere, pollution, how we live our life, all things, stress which we have. We are always worried nowadays. So all these things come together, and that can lead to low AMH in the woman. Important here, Asmita, is that what is the age of the woman? At 40 years of age, AMH come hoga hi. That's acceptable. But in a young girl having low AMH is matter of great worry. And I think we have to uh, change our lifestyle to counter this problem. Thank you.
Yes, sir. So next question would be: is there any disease, condition, or familial factors that is involved in low AMH?
Yeah, very good question which you just answered yourself. आपने तो जवाब खुद दिया है इस सवाल का. You spoke about something like familial diseases, autoimmune disorders. I think जो मेरे नजर में जो चीज मेरे को दिखती है आजकल, or probably I think Asmita, we are trying to diagnose these things more, is endometriosis. So endometriosis is quite becoming quite common. या पहले था, हम इसे पकड़ नहीं पाते थे. आजकल endometriosis का detection rate has gone very high on ultrasound. So people have got पहले ही कारण था tuberculosis. हमारे देश के अंदर TB बहुत common था. I'd like to ask you how common is TB in your country? But in our country, TB was quite common some time back. But now I think it's endometriosis which can lead to, which can affect the ovary. And I commonly say that endometriosis is like it's a disease of the whole small whole abdomen where the endometriotic fluid can go and deposit. और जब भी किसी ओवरी पे जाकर ये चिपकता है, इससे the menstrual blood goes back, then it can lead to problems and it can affect the health of the ovary. So endometriosis is a common condition. And besides that, there can be few genetic conditions, there can be autoimmune disorders which are quite rare, but they are definitely in the society which can lead to low AMH. And then there can be some familial condition. देखा होगा कि कुछ ladies को they undergo menopause at 40 years of age. So we say that they have got premature ovarian insufficiency or premature ovarian failure, and that can run in the families. तो अगर माँ को है तो बेटी को भी शायद हो सकता है, but not very common, but it can happen. So it can run in the families. So these are the common conditions which can lead to low AMH. But more important than them will be our lifestyle, the way we are leading our lives, our stress factor, eating all junk food, not sleeping, and not taking the subtle signs from the nature कि हमारा शरीर थक गया है. We keep working, and then gradually the first organ to get hit in the woman is the ovaries. अगर आप देखें किसी भी घर के अंदर, कई बार मैंने इस पे आत्ममंथन किया. I thought about it, who lives longer, male or a female? So what I have noticed is that in any family, the female partner lives around 3 to 4 years more than the male partner. अब COVID देख लीजिए. Women are so tough. The women could survive COVID, men could not. And it is not only me. Look at the eldest woman in the world from France. She lived for 122 years. They're always, women live longer than the men. So, but a woman will lose her fertility by around 41, 42 years of age or 43 years of age. So this is the way God has actually designed a woman so that her fertility potential goes down by 40 to 43 years of age. So that's the beauty of the whole thing. And I think the first thing to get hit in the woman is the ovaries. उनका heart will remain stronger. उनका हृदय, उनका जिगर, liver, they will outlive the man in everything. They'll outlive their body in everything. They'll have a healthier heart, healthier brain than the men, but their ovaries will get hit at 40 years of age. That's the way the woman has been, her physiology has been designed by the God. So I think it's a very important, pertinent issue, and all the women should take care of the ovaries too. They look at themselves, they look at their overall health, but they don't look at their ovaries. And in case we make an error of judgment, having a lot of coffee, tea, smoking, alcohol, a lot of people take a lot of drugs. आजकल men और women धीरे धीरे पूरे समाज में बराबरी का दर्जा हासिल कर रहे हैं. And I think the women are moving faster. That's the way. Women has to be empowered. But men में ovaries नहीं होती है. women में ovaries होती हैं, they get affected. So that can be a reason that the women are having more chances of low AMH nowadays. Thank you.
So you have explained very well. So next question is there any ways to increase AMH levels?
Yeah, again, the whole of our industry, I think नेपाल में भी होता होगा. नेपाल के अंदर भी आप बात करते होंगे how to increase the AMH. कहीं भी
Yes, we
जाएं,
have.
आप किसी भी देश में जाएं, they talk of increasing the AMH. आजकल AMH is a over the counter test. Every woman, I think any girl who's before getting married, she like to check her AMH. Call somebody from lab, give a blood and know her AMH. She wants to know her fertility potential. So पहली बात ये सब मैं बताना चाहूंगा कि AMH doesn't reflect your fertility potential. It does give some indication, but even with a low AMH, people can conceive. That is very, very important. Now, can we rebuild our AMH? Can we reboot? कोई ऐसा तरीका है कि हम एक कंप्यूटर में जाएं और उसको डीफ्रेगमेंट करके उसमें एक नया एप्लीकेशन डालकर we can give her a new ovaries? I think no one has got an answer, neither in Nepal, nor in India, nor in any other country. But there are many ways by which AMH values, falling values can be countered. They may be low, but egg quality can be improved. So there are multiple studies, Asmita, all over the world. So I think this you asked me, जो दवाइयां हैं हमारे पास में, people use something like DHEA, which
Yes.
they say can benefit you, but there is no surety. CoQ is one drug which I'm very fond of. CoQ is the only drug which tells that yes, AMH values may go high in some cancer patients. So CoQ has got some evidence, slight evidence. DHE we're giving to all, CoQ we give to all the patients. Some people are using some sort of gels. They are called testosterone gels. We have a spray on our forearm, take one spray every day for 45 days. That increase the levels of AMH in the body. Some people are using intraovarian PRP. तो हम क्या करते हैं कि एक ब्लड लेके उनके प्लेटलेट निकालते हैं and then we put those platelets in the ovary back in that woman. They're called PRP. But these are all hypotheses. There's no surety that they will increase AMH or not. But yes, definitely they'll definitely increase the quality of eggs. Now, what I'm very fond of myself is something like yoga. Yoga is known to increase the quality of eggs. There's a beautiful study done at Maulana Azad Medical College by Dr. Sudha Prasad sometime back on 700 cases on yoga. And she found that it can increase the quality of eggs. The number may not vary, but quality increases. Very nice study done at MAMC in Delhi. Then people who sleep well, have a lot of water, have good diet, lose their weight, have good habits, and have a lot of healthy living. They take dark vegetables, and then there are some people talking about Ayurveda, acupuncture, acupressure. I think they're all hypothesized. I can't say that they increase, but definitely having a healthier lifestyle will increase the quality of eggs. May not be the AMH, but it's worthwhile trying these things. और मेरा तो जो simple तरीका है, I don't believe in expensive medications. I say that take a half a amla or gooseberry every day. Amla is a very beautiful thing to take. Take an amla, take
Antioxidant.
some akroot, raisins, antioxidants, they work very well. So अगर आप देखें अस्मिता पांडे जी के DHEA, CoQ, they're all antioxidants. No, Asmita, everything is antioxidant.
Yeah.
And they are expensive antioxidants. Barring CoQ, we don't have much of evidence. So I think we can take some walnuts, some nuts, some berries. We can take some हेल्दी डाइट हैव लॉट ऑफ वाटर बहुत पानी पीने से हमारी बॉडी से टॉक्सिन्स रिलीज होते हैं तो पानी पीना दिन में कम से कम 2 या 3 लीटर कैन हेल्प अस these are the basic methodologies by which I think we can may not increase the AMH but we can increase that quality of eggs and we have to know that there is no evidence based medicine saying that what can increase the AMH जब तक हमारे पास कोई एविडेंस नहीं आता है so we can try any therapy which may not harm the patient, but it may not benefit, but we are trying all these things that we may get some better outcome.
Right, sir.
Yes,
So next most frequently asked question is, does low AMH affect my menstrual cycle or health as a whole?
absolutely, Dr. Ashmita. This is very, very important question. See, हमारा जो काम करने का तरीका समय के साथ we are looking at more of the reports. You will find that the young doctors like you, who are all trained all over the world, and you are the teacher. So you people are the future of the world, and you will be our teachers in many ways. So the new generation follows AMH, ATM card. We people still follow the clinical diagnosis. So अगर मेरे को देखना होता है कि किसी का how is the lady doing, how much will be her AMH, I look at her hair, मैं उनके बाल देखता हूँ. मुझे कई बार कहते हैं पेशेंट के मेरे बाल क्यों देख रहे हो? I look at their face. Why are you looking at my face? ऐसे तुम्हारा AMH 3.5 होगा या 4 होगा. कहते हैं how do you know? तुम्हारा चेहरा देख के मैं बता सकता हूँ कि तुम्हें PCOD है कि नहीं. बेसिक. अब देखें तो PCO एक बीमारी है, छोटी सी एक स्मॉल इशू इन गायनेकोलॉजी. हमने बात करा AMH लो होने का. सो AMH हाई भी होता है. So when somebody has got a PCO, her AMH values can go high. That's called PCOD. So I personally feel that a PCOD can be diagnosed by looking at her face. हम उनका चेहरा देखते ही बता सकते हैं कि मोटा मोटा कितना AMH होगा किसी पेशेंट का, because we look at their acne, look at their shiny skin, look at their the hairs are cracking. She may be taking some sort of skin treatment, and she's got PCO, her AMH will be high. और जब हम probe लगाते हैं हमें उतना ही AMH दिख जाता है. We get so many AFC. तो एक चीज हम शायद बात नहीं करा अब तक हमने कि AMH इज नॉट ए वेरी रिलायबल टेस्ट. ऐसा नहीं है कि AMH एक बहुत ही अच्छा टेस्ट है. AMH अच्छा टेस्ट है, बट वेरी फ्रिक्वेंटली वी गेट कंप्लेंट्स कि AMH की वैल्यूज वेरी करती हैं. सो आई थिंक वन थिंग वी हैव टू डू इज दैट वी शुड डू एंट्रल फॉलिकुलर काउंट फॉर एवरीवन, दैट इज कॉल्ड AFC. सो सेकंड डे पे जो हम स्कैन करते हैं, दैट शोज हाउ मेनी फॉलिकल्स द ओवरी हैज, एंड दैट हर एज एंड द AFC is the most important method by which we can correlate both the things. But yet, AMH is a very good method. When you want to do an IUI or IVF, then AMH becomes very, very important. Yes. And test
Next
बहुत
question.
महंगा है. And the test of AMH is pretty expensive. एक महंगा टेस्ट है.
True, sir.
ये टेस्ट
Expensive in
तकरीबन
Nepal.
1,000 से लेके. नेपाल में क्या प्राइस है इसके टेस्ट का? How much do you
So
charge
it's
normally people
5,000
charge?
Nepali rupees, which should be around 3,500 INR.
ये तो अगर इंडिया में भी देखें तो इस टेस्ट की जो कीमत है वो तकरीबन 1100-1200 से लेकर 4,500-5,000 तक जाती है. आई थिंक इट्स वेरी एक्सपेंसिव टेस्ट, एंड ऑल द वुमेन शुड नॉट बी सब्जेक्टेड टू AMH टेस्टिंग. आई पर्सनली फील वी शुड बी लुकिंग मोर एट द एज एंड द AFC.
Yes.
बट अगर किसी का AFC ज्यादा है एंड वी वांट टू कैरी आउट देयर IVF और वी हैव टू गिव देम सम स्टिमुलेशन, yes we can correlate, but we shouldn't make a habit of doing AMH for all the patients. और ना ही सबको डरने की जरूरत है. AMH को डराता भी है बहुत. मेरा AMH बढ़ गया मैं क्या करूं, मेरा AMH कम हो गया मैं क्या करूं. So I think AMH is not required in every patient to be done. This is my take home message. Yes, over to you.
Next question is AMH only parameter to decide which type of stimulation protocol or whether we have to go for IVF or IUI is enough? So is it the only parameter to decide? But I think we have just answered that most important is AFC and age.
एज.
Still,
अभी डॉक्टर अश्मिता समटाइम बैक ना, जब 2010 में जब ये टेस्ट लॉन्च हुआ था, ये बात है 10 से 11 की बात है, when AMH was being launched. That time we were looking at it with a lot of skepticism. Humans don't accept everything. So we are looking at it with a lot of skepticism कि इसे हम accept करें कि ना करें. So AMH initially when it came as a test to look at the cancer patients. So somebody had a cancer, उसका AMH के values कितने हैं, तो we thought that way. We never knew it would become part of our armamentarium. But gradually IVF evolved in our country, और हम एक ऐसी stage पे पहुंचे जब large number of women were having multiple pregnancies and they were having ovarian hyperstimulation. So अगर आप 10 साल पीछे जाएं, I should go back around 15 years. It was routine for us to get an ovarian hyperstimulation like condition. We were having multiple pregnancies, which are now banned. Nowadays, I have not seen ovarian hyperstimulation in the past 7-8 years. I've not seen multiple pregnancy in past, I think, 4-5 years. But there was a time, Dr. Ashmita, when in my hospital, at Army Hospital, New Delhi, the biggest hospital of the country in terms of IVF, we had a separate ward for ovarian hyperstimulation. At any time we used to have 10 to 12 patients of ovarian hyperstimulation, because we probably, हमारे पास अच्छी दवाइयां नहीं थी, हमें इतनी समझ नहीं थी, और हमारे देश में ही नहीं, the whole world was fighting ovarian hyperstimulation. Then came AMH, और मैं AMH ने हमें बताया, because हर डॉक्टर एक अल्ट्रासाउंड के थ्रू डायग्नोस करना उसके लिए मुश्किल रहता है कि क्या आउटकम आने वाला है. सो AMH गिव्स यू अ वेरी गुड क्लीन. सो वी नो कि अगर किसी भी in case a woman has got AMH of less than 1.2, so we start with gonadotropins जो टीके लगाते हैं HMGs के, we give 300 units. In case AMH is more than 6, we go to 75 units. In case the AMH is between 1.2 to 3, we give 225 units or something of that nature to start with. And anything between 3 and 6, we give 150 units of gonadotropin. So we have made a method by which the whole world can follow some guidelines and they can. हमारा एंड में एंड पॉइंट हमारा होता है लाइव बर्थ रेट एंड क्लिनिकल प्रेगनेंसी रेट. बट इसके अंदर जो ओवेरियन हाइपर स्टिमुलेशन आता है हमें इसे अवॉइड करना होता है. अगर हम बिना देखे समझे किसी भी स्त्री का आईवीएफ करते हैं या आईयूआई करते हैं, she can have complications. And AMH is a very good method when we give anybody gonadotropins like HMG, FSH, looking at the levels of AMH, correlating it with AFC, we can titrate our dosages. So it's a very good method to titrate the dosages. But yes, Dr. Ashmi, the point here is that in case uska AMH is less than 2, it'll corroborate very well with their AFC. So I think you need not do AMH for every patient. When she's looking like a PCOD woman, she's got large number of follicles. अब जब हम स्कैन करते हैं तो हमारी प्रोब हमको 2D व्यू देती है. It doesn't give us a 3D view. Half the time we don't use that advanced methodology. We don't have sono AVC where we can put the probe and we'll get number of follicles present inside, because ovary may be big and follicles may be lying behind. So a sono ABC or some new technology can give us a 3D number of the follicles, which we may tend to miss. So I think whenever you're giving somebody gonadotropins and her number of follicles are more than 13 to 14 total, we should do an AMH and get a proper, because endpoint will be giving her not only good live birth rate, clinical pregnancy rate, but also a healthy journey towards that. In case a woman develops ovarian hyperstimulation, she has multiple pregnancy, it's the wrong thing to do. So I think I agree with you. We should do AMH for the people without any worry, in case her AFC is more than 10 to 12.
Thank you, sir. So I think we are running out of time. So last one question. What is the lower cutoff of AMH where you counsel your patient that beyond this, it's not possible to go with your self cycle and you have to take the donor oocyte?
You're trying to catch me, Ashmita. You're trying to catch me on the wrong foot. I can make that out. So, हम जब भी भगवान बनने का ट्राई करते हैं ना, तो God teaches me that you're wrong. I have had pregnancies at AMH of 0.04, 0.06. हमने बोला डोनर होगा, उसने बोला मुझे डोनर नहीं करना है. हमने बोला तुम जाओ, हम तुम्हारा इलाज नहीं कर सकते. और 2 महीने के बाद she comes with a pregnancy. Not once, many times. There was
So
a case.
natural without any medication, sir.
Yes, natural she's conceived. I'll tell you one very wonderful example. ये हमारे देश का पहला केस था. We did one ovarian tissue freezing for a cancer patient. Ovarian tissue freezing, जब किसी कैंसर होता है, we take out her ovaries and we transplant them back. This again we did at Army Hospital. So we took out her ovaries and we gave her chemotherapy. और जब फिर हमने उनकी ओवरीज को, उसकी AMH बहुत कम हो गया, AMH came to 0.1, 0.2, very low AMH after chemotherapy. So we had kept her ovaries. तो हमने उनकी ओवरीज को पहली बार ट्रांसप्लांट करा. इंडिया का पहला केस था वो. We transplanted. So ovarian transplantation failed. And we said, now we have lost everything. अब तो कीमोथेरेपी भी हो गया, ओवरीज भी खत्म हो गई, फेल भी हो गए. So we said, sorry, nothing. Now you can go in for donor cycle or you can adopt a child. Exactly 4 months later, she came with a pregnancy, natural pregnancy.
Wow.
And she became a mother. So I think there is no age, Dr. Ashmita, there is no age, there is no cutoff of AFC as such. I think it's our communication. Every woman who has a low AMH, low AMH means less than 0.4 or very low, 0.3, 0.4. You must give her a try in case she's young. Yes, in case the woman is slightly elderly, more than 38, 39, very low AMH, her chances are low. But in a young woman, I've seen pregnancies at less than 0.1 AMH also. So please give them a chance, and we shouldn't push them towards egg donor cycles. Yes, in case a woman has got very high FSH, tune of say 30, AFC not seen, AMH low, age 38, 39, 40, premature ovarian failure, yes, donor cycle. But in a young woman, just be careful. Because कहीं ना कहीं पे फिर हमको भी get shocked कि कैसे हो गया. And I've seen it happening in my life many times. So no woman should be advised at donor cycle until she really deserves it. And because हमारा role क्या है, Dr. Ashmita? Our role as IVF doctors is that we should give them their own child, and we have to fight for their own child. Donor is a very easy method, but that should be avoided, I feel.
Right. So I think you have answered everything wonderfully, and I think you have covered everything very well. So if anyone has any questions, they can type it. I can read it out for sir. We don't have any questions yet.
So thank you so much, everyone. I think we had a large number of people who joined in, and we spent around nearly 40 minutes with all of you. I would like to thank Dr. Ashmita from Kathmandu. She's a very busy doctor. Thank you so much for sparing your valuable time. And our endeavor is to educate people. So all these things go a long way in creating confidence in the medical fraternity from all of you. So we are always there to help you 24/7. We like to educate you, treat you. You have running below our telephone numbers, and inquiries can be made. We are there for you 24/7. You can contact us on our website. You can call us up. You can send us a WhatsApp message. We are there with you. Thank you so much for being with us, and thank you so much, Dr. Asmita, for being with me. We really enjoyed
Thank you.
today's session, and we'll come back very soon with another episode of a similar topic.
Sure. Thank you so much, sir. Thank you everyone for joining.